Okay, so we've made it. Module 13 is our last module for Chapter 6 on anxiety disorders and obsessive-compulsive disorders. And so what we're going to wrap up with is talking about treatments for OCD. And as you might have seen with the symptoms and the fact that a lot of people continue to have symptoms of OCD going on even decades, the treatments aren't a huge variety. And so this is going to be probably a fairly short module. So the main treatment is going to be exposure and response prevention. It's the most effective form of psychological treatment for OCD. And what it does is it combines that prolonged exposure that we talked about in the treatment for behavioral issues like phobias, specific phobias, to the situation, and it help increase a person's anxiety, but at the same time, then they prevent the person's typical compulsive response. So, for example, they may have the patient put their hands in dirt and then don't let them wash their hands. And so then they have to deal with the anxiety of what happens when they have that dirt on them. And, you prevent them from washing it. And eventually, that obsession may diminish because they see the illogic aspect of it, and they realize that they're going to be okay even if they don't wash their hands. And so that would just be one example of this kind of exposure response prevention. And then we also have some biological treatments that usually have like medications. And we already talked about that when we talked about anxiety disorders. So SSRIs, once again, they're chosen a lot because they have fewer side effects than a lot of the other medications, and they have all the positives that we talked about, when we were looking over the SSRIs compared to the benzodiazepines when treating anxiety. And then we also have clomipramine or anafranil. This is a tricyclic antidepressant, and it's used extensively in treating obsessive compulsive disorder. So they've found that to be pretty effective. So we've covered a lot of ground in this chapter. We've gone through all the various types of anxiety disorders, things like social anxiety disorder, specific phobias, generalized anxiety disorder. And then we've also gone into more specific things like obsessive compulsive disorder, hoarding disorder, body dysmorphic, excoriation, trichotillomania. So as we saw in the very first slide of our chapter 6, there are a lot of anxiety disorders. There's some debate as to whether there's too many of them, and maybe that we should narrow those down a bit. And then we see that there are a variety of treatments. I think the good news with anxiety disorders is there's some very validated treatments that seem to work very well for it, and that some of those treatments also seem to work pretty well with obsessive compulsive disorder. So you have like cognitive therapy, you've got the behavioral therapy, you have medications, and then of course things like that exposure kind of and desensitization process. Okay, so that wraps up this chapter, and tune in for our next one in Chapter 7.